Hospitals are places of hope and healing, but also of pain, uncertainty and loss. Therefore, Hospivision is a natural and indispensable part of the hospital landscape. Don't ever think, I will never fall ill, I will never end up in hospital. It can happen to someone close to you, and yes, it can happen to you. But imagine what a difference it'll make to face the hospital experience with a compassionate Hospivision friend who gives hope through counseling and spiritual care. Hospivision also provides support to the families of patients as well as medical staff. Hospivision accomplishes a lot in many hospitals. In the Pretoria Academic Hospital alone, we reach approximately 1,000 patients per month. However, the need is enormous. 1.2 million patients per year are treated there by 5,000 staff members. Hospivision can do so much more if we just had more resources. Hospivision has a dream that every patient in every hospital in South Africa be touched by unconditional love and care. Hospivision also extends their expertise to the community. Over 350,000 inhabitants of the city of the Greater Pretoria are HIV positive, and over 30,000 children have been orphaned by the virus. This staggering infection rate keeps growing. Hospivision is a Christian-based non-profit organization that touches the lives of sick and desperate people and gives them hope. Hospivision is like a tree with many branches. It touches lives and brings hope in various ways. Hospivision counseling and spiritual care gives emotional and spiritual support by personally visiting patients at their bedsides. We care through being there, listening without judgment, holding a patient's hand on the way to the theatre, calming fears of someone with a terminal illness. The Oasis is a haven for traumatized patients who have tested positive for HIV. At the Oasis, they can count on having their needs met, whether it be counseling, clothes, a warm nutritional meal, love or encouragement. The Children's Care Train brings care and emotional healing to vulnerable children who are sometimes in hospital for weeks or months with few visitors, no friends, no playing outside. Hospivision makes this so much better through a soft toy, warm pajamas, but best of all, through love and attention. Hospivision's answer to the spread of HIV and AIDS is the Choose Life program. We believe values like respect, responsibility, love, integrity, fairness and service will change people's behavior and give them a better future. The United States Aid for International Development show their belief in this program by funding part of it. Hospivision's training programs are available to both professionals and volunteers in caring for the needs of sick people. All programs are accredited by the University of South Africa. Special employee assistance programs have been created by Hospivision to help staff cope with the day-to-day stresses. It addresses issues like debriefing, building resilience, conflict management, and maintaining a sense of meaning in their chosen profession. Hospivision trauma counseling is available to staff, patients and family on a 24-hour basis. Our trauma team stands in the front line of caring for patients whose lives are, in the blink of an eye, turned upside down by motor accidents, heart attacks, hijackings, strokes, near drownings. At one hospital alone, 8 to 10 suicide cases are reported daily. Hospivision Time, our weekly radio program on national radio, strengthens and informs thousands of listeners with interviews, news and all aspects of health and spiritual well-being. Hospivision is dependent on volunteers to be effective. Our volunteer services programs empower those wanting to become involved. We believe that caring for others is a privilege and an opportunity to grow. At Hospivision, we help people regain their dignity despite their health struggles. We want to help people get their lives back by finding new meaning in suffering and despair. Illness in itself does not define the patient. Trauma need not steal your life. Love support, and the presence of God bring hope and healing, even in devastating situations. We invite and challenge you. Get involved. Bring the faithful offering of yourself in whatever way. Stand out amongst the rest. Take our hands and help us to do what we do best. Touching lives, giving hope.